Hi, my name is Wendy Sherry. I'm the MUH Seniors Clinician for Organ and Tissue Donation, and I'm here today to talk to you about organ and tissue donation. The slide that you see outlines what I'm going to talk about, which is what can be donated, the how, what, and who of donation, the importance of communicating what you want to donate, a little bit of statistics, and give you a little overview of the types of donation that you can do. So what can you donate? So you've got two columns here. One side is organs and the other side is tissues. There's a very important difference, though, between the two columns. On the organ side, organs need blood and oxygen to function properly. Tissues, on the other hand, don't need that at all. So that means that recipients who get a transplant with an organ need to have immunosuppressants. This is super important because that's to make sure that body doesn't reject the organ. But that means also a lot of doctor and medical follow-ups. So biopsies are much more at risk for cancers. This is something that we hope that doesn't happen, and they'll hope they have a long life with their organ. Tissues, on the other hand, when they're transplanted, maybe a few antibiotics, steroids just because of swelling, and then it's yours for life. Don't have to worry about any of the immunosuppressants or rejection. Back to the organ side, cause of organ death, because that's where the list is really the biggest need. Most of the organ donors have a type of stroke, either ischemic or hemorrhagic, or they've been in some kind of accident and with a big head trauma. It can be done through motor vehicle crashes, a motorcycle, it's very important to wearing your helmet, or even skiing in a wrong area and hitting a tree. A cerebrovascular accident, or what we always call a stroke, can be a rupture of an aneurysm in your brain, which then floods your brain with blood. And if you think of your head, it's a very solid box because it's all closed in by bone, and there's no room for all that extra blood in it. Also, if you have an ischemic stroke, that's when you have a blood clot that blocks off a vessel, and then the blood can't circulate in the brain, and so the brain swells. Same effect as of too much blood. You have the swelling, all the bone. There's no room for all of that swelling, and the brain stops functioning. Causes of cerebral anoxia, or a lack of oxygen to the brain, can be caused by choking on food because you're eating too fast or your pieces of food were just too big. Drowning, which can be teenagers not knowing how to swim, or even young children not knowing how to swim. So we get a lot of calls on that during the summer. Suicide by hanging, which will cause a lack of oxygen to the brain. Prolonged cardiac arrest, that's probably the biggest category of where we get a lot of people. So these are typically not your age, but older people whose hearts stop functioning and have a lack of oxygen to the brain, and they'll cause all that swelling, and then the brain stops functioning. There's what we call also birth asphyxia. Birth asphyxia means that when the baby is being born, when they come out, they get stuck in the canal. And again, a lack of oxygen to the brain and swelling occurs. So we have a lot of people on the wait list. We've done really good. On the graph, you can see that over the years, we've really cut down on the number of people. 10 years ago, we had over 1,200 people waiting. Now we're just under 800. That's an awesome thing that we're doing. But there's still a lot more people waiting. And a donor can only donate so many organs. If you think of a baby, they can donate their heart. If you think of someone who's much older, they might only be able to donate a liver. So not everybody can donate for like 5 to 7 organs. So this is why it's so important to make sure that we absolutely identify every single potential donor. So the people, the referrals that go to Transplant Quebec, a number of them are declined because even if they meet the eligibility criteria in terms of, and with damage done to their brain, not everybody can donate their organs. This might be because they have a cancer. This might be because maybe they have something else that interferes with them donating their organs. And there's also a great number of people who actually decline organ donation. And this is usually due to lack of knowledge. So you guys will be able to bring the information I'm giving you today back home to your parents so you guys can have a discussion. Very important. So I mentioned age before, and I mentioned that maybe the oldest person could donate a liver. If you look at the list that's there, 92 years old, that's the oldest living liver donor. A cool story, though, happened with an 88-year-old man who donated his liver, and a 19-year-old girl. She was living in Quebec, but traveling Canada, and while she was in Toronto, she suddenly collapsed on the sidewalk. Her boyfriend, who was with her at the time, called 911 in the hospital. And she got to the hospital to be told that at 19 years old, a virus had attacked her liver and she needed a liver transplant. And she needed one urgently. And the only liver that was available came from this 88-year-old man. And she's thinking, I'm 19. That's a huge age difference. And typically, we do try and match up the age between the recipient and the donor. But in this case, they couldn't wait. It was the only liver available that day, and she needed it right away. So the doctor said, we'll make a deal with you. Take the liver, and we'll call it a bridge liver, which means we'll be on the lookout for a liver that's closer to you in age. She said, awesome. Fast forward a number of years. She's now married to that young man that she was traveling with. She has 3 beautiful teenage daughters, and that liver is 105 years old. Pretty cool, eh? Now, why can the liver do so well at 105 years old? Because it has a magical property that none of the other organs can do, and that is it can regenerate. So think about that. Age is really not a factor with organ donation. Now, it's very important, though, as I mentioned before, while talking to your parents and to your friends, too, about what you want to do, but there's also 3 ways you can indicate to others that you want to donate. The first one that most people know is signing in the back of your Medicare card. But also, there's the notary registry. Your parents will know about this. You guys are too young for this. And that's when you do your last will and testament, and your parents can decide, do they want to donate their organs? And notary also says, if you don't want to donate your organs, which is pretty cool, which means you can make clear what you really want to do. Right now at the notary, 85% of people have consented to organ donation, and another 15% have said, no, thank you. And we're over 2 million people have filled out this type of registry. There's also the RAMQ registry. That's affiliated with your Medicare card. And that's pretty cool. We almost have 4 million people who said they want to donate. The RAMQ registry only takes those who want to consent. And what's cool about these registries is that if you or a member of your family end up in the hospital, we'll take your name, your RAMQ number, we'll give it to Transplant Quebec, who looks after organ donation, or Emma Quebec, who looks after tissue donation, and they're going to check the registries to know if your name is on one of those registries. And then we can inform your family and friends about what you wanted to do, and so have a really good discussion. But not everybody is comfortable signing these registries or signing the back of their card. Some people are afraid that if they get into the emergency department, they're going to think, oh, look at that, someone signed their card. They're young and they're healthy. We're not going to work so hard to save their life. This is not true, but some people are afraid that it might be true. People are also scared about putting their name on anything because they're afraid that if they say that they want to donate, that means some catastrophe is going to happen tomorrow and they're going to be dead. So that makes them really nervous too about signing those things. So instead, what you could do is talk to your family and friends about exactly what you want to do. That's the best way, and that's whether you want to donate or whether you don't want to donate. The most important thing is that someone knows what you want to do, so that then we know what to do at the hospital. Now, it's really important that if someone does give consent to organs, that we need to do this in a fairly quick process. So the process to get to somebody ready for procurement for organ donation, which is, by the way, always done after you're dead, not before, that can take 2-3 days. Sometimes we evaluate all the organs, we take the blood from the donor to find recipients. But once they're out of the body, we only have so many hours to get them transplanted. Heart and lungs are definitely the shortest, 4 to 6 typically. Now sometimes we can have exceptions. When I first started doing this job 15 years ago, there was a little girl at the other end of the country who was waiting for a heart. Now, 4 to 6 hours to get a heart from Quebec all the way to BC, that's kind of short. So they asked for a derogation, and this meant it gave them a few more hours to do so. So Transplant Quebec organized a supersonic jet to fly that heart across the country to this little girl, and the heart was successfully transplanted. So there's always ways to do things. Pancreas and liver, also we got to do them within 12 hours. They're pretty fragile too. The kidneys are the most resistant. We can go up to all the way 48 hours. Now that's pretty rare. We really try and do this within 24-hour period because that's when the kidney is at its best. What's cool right now though is we have these things called ex vivo machines, We have them for lungs, and we have them for kidneys. And what we can do is, when they're taken out of the person's body, instead of just being put on ice and kept cold to keep all the cells in the organs healthy, they're put in the machine and they're able to work. So they'll keep working until they're actually transplanted. And this means that gives us a few extra hours to get them to the right person. So this is really cool. Now, estimated organ wait time, when I started 15 years ago, some of these numbers were well over 1,000 days. So I'm really happy to see there's been a lot of progress, as we saw in the chart before, with just under 800 people waiting. But there's still people waiting a really long time. Something to think about. For those of you who know your blood group, are you an O? Or like an O negative, which is the universal donor, by the way, or an O positive? If you're either one of those blood groups, like me, I'm an O positive. If we need an organ, we typically wait a little bit longer than some people, because when a donor becomes available in our blood group, everybody is pretty much eligible for one of our organs. So I always tell people, we got to take that little bit better care of ourselves to ensure we don't end up on a wait list. Also important to remember is that of all those numbers, 70% of people on the wait list need a kidney. That is the organ that's most in need. And what's really cool about the kidney is what we call deceased donation. Basically, after you die, you can also do living kidney donation, which is really cool. You got one to spare. So that's something that you might want to think of when you're an adult to help somebody else. Donor age groups, they follow the baby boomer curve. I'm sure you've heard the term baby boomer. Well, that basically means the average age of the population in Canada. And this particular group is based on the average age of people in Quebec. And that, as you can see, there's a lot of donors that between the ages of 51 and 60 years old. And if you take a good look at the graph, you'll see that 50% of the donors come from people over the age of 50. If you look at the lower half of the graph, you're going to see the 18 to 30 group. So 17 donors that were there in 2019. This is the group that I'm most concerned about with you guys, because I'm doing this as a trauma prevention. So a heads up, don't be one of these people in this group, especially you young men, because you guys are the worst risk takers. Okay? If you're out and about, please remember, put on your helmet if you're on your bicycle or on your motorcycle. Don't go through those stop signs. Put on your seat belts. Don't drink and do silly things. Be really careful, because most of the people in that age group, unfortunately, are males. They're the ones who are the risk takers. We have to remember, though, that deceased organ donation is very rare. The only ways you can donate your organs is after death. And there's a couple of ways to do this, but one of the major ways we do it is neurological determination of death. So what's that? So and I'll say very clearly, it's less than 2% of people die in this particular fashion, which means that out of all the people who die in Quebec, only 350 people are eligible, and that's before we have all those exclusion criteria in that I showed you in a previous slide with Transplant Quebec. So who is a potential organ donor? So out of this 2%, as you saw on the slide, it's patients of all ages. There is no age restriction for organ donation. And there are people who are very, very ill and typically have some kind of brain trauma, which means that the brain is really not functioning very well at all or is not functioning anymore. People are usually on a ventilator, and they cannot have cancer because that's an exclusion criteria for organ donation. So when we do what we call determination of neurological death, this is what we're going to be testing is the brain stem. But before we can do that, we got to make sure there's no confounding factors. So what's a confounding factor? Well, that means that there's no drugs in your body, and that could be drugs that maybe a person came in with from alcohol, smoking pot, IV when they were shooting themselves up, or it could be drugs that we gave you in the hospital. So we got to make sure that when we do the tests, those drugs aren't on board and they're not going to distract and give us the wrong result and say someone is dead when they're really not. So that's super important. The other thing too is to make sure we don't make any mistakes is we want to make sure that the body temperature is okay. So it can't be less than 34 degrees and it can't be higher than 38 degrees Celsius. And you guys maybe know, I don't know how much science background you have, but we also look at what we call electrolytes. And electrolytes are super important. They make the heart work better, your body work better. But one of the magnesium, if it's too low, that will make it look like someone is brain dead when they're not. So we want to make sure that all of these things are in perfect working order before we start our test. And once we do that, we want to make sure that we also have 2 physicians who are going to be there for the tests. And that's because one is there they're both there to make sure that it's done properly, but one is there to declare that someone is dead, and the second physician confirms the finding of the first physicians. And when all those tests are finished, that is the time of death and the date. So what are we testing exactly in that brainstem that I was talking about? So the brainstem is here in the nape of your neck. So what we do is the physicians go down from the top of the brainstem all the way to the bottom. So what are they looking at? They want to be sure that you have no reaction to pain. They want to be sure that your pupils are fixed and dilated and not reacting to light. They're going to check your corneal reflex, which is your blinking reflex. So they're going to take a little Q-tip or a little cotton swab on the corner of the eye and make sure that that is also absent. Oculocephalic is what we call the doll's eye reflex. That can only be done on patients who didn't have a neck trauma. Because if we're going to be jerking around the head, it's not going to be good for someone who really is not dead. So we cannot do that one on someone who's had neck trauma. And what it is a quick jerk to the left and the right, and we call it the doll's eye reflex, because your eyes are going to be looking straight ahead, and they're not going to be wavering to the right or the left with the jerk of the head. When we can't do that particular test, we do what we call an oculovestibular reflex. This one is really not comfortable. It's a good thing that this is done on someone, mostly with my patients, who are dead. Because on a living person, you would not be a happy camper. It's injection of 60 cc's of ice cold water into each eardrum one at a time. If I do that to you or me, one, you will be swearing very loudly. You will be trying to hit me and push me away, and you will have projectile vomiting. Interesting experiment maybe for some, but really not something we want to do to each other. So on someone who we believe whose brain is not functioning, the water is going to go in and come right back out, and there's going to be no reaction. Absence of pharyngeal reflex, that's your cough and gag. So they remember I mentioned the ventilator? Well, to be on the ventilator, you have an endotracheal tube, and that goes down through your throat into your lungs. So the doctor is going to give it a good tug, because he wants to see if you're going to have a cough or gag reflex. And the last one is a respiratory reflex, and that's what we're going to check to see if the person is breathing. And when we do that, if we think of the World Guinness Book of Records, I think the record for someone holding their breath is just under 4 minutes. So our test is 10 to 15 minutes. And again, we have checks and balances. We have a pre-blood gas test and a post-blood gas test. And we do that because we want to check the values. Because we all breathe air, and so a lot of people assume that our body works on oxygen. But it really doesn't. It works on CO2, what we give off. So when we turn off the ventilator, after we've flooded the whole body with lots of oxygen, and we use like a cork to keep that oxygen inside it, our CO2 is going to start rising in our body. And when it does, the lungs are going to try and send a signal to the brain saying, hey, aren't we supposed to be doing something here? Aren't we supposed to be taking a breath? But the brain is not functioning. So that CO2 level is going to keep going up and up and up. And that's what we're going to see, a really huge increase on that second blood gas test. So at the end of the 15 minutes, we stop the exam. There's always the 2 physicians there looking at all of this to see whether the person's breathing or not. And we use those blood gas tests to confirm our results. At the end of all that, if all those brainstem reflexes are absent, that means someone's neurologically dead, or what's often known as brain death. And this will then be told to the family. At this point in time, we do not talk about organ donation to families. It's super important, because we don't want to seek like vultures. We want to make sure that the family really understand that the brain is not functioning anymore. And that can be really hard for family to understand. Why? Because on the ventilator, the body stays pink and warm. We can see the chest rising and falling. There's a rhythm on a cardiac monitor. And it really often, if you don't have a head trauma or like a Band-Aid or some kind of, your face doesn't look normal, you got a black eye or something, people look like they're sleeping. And that's really hard for members to understand, is saying, well, you're telling me that they're dead, but they really don't look dead. So a lot of times when families have a struggle trying to understand this particular concept, we will actually invite them in for the testing because we want them to see and to understand this is us. We have nothing to hide. Now, remember I mentioned before if we can't do one of the tests, like the doll's eyes, the jerking, sometimes we can't do the test either because there's a really big black eye, or maybe because they have a neck collar. Their neck is broken, and so that means we can't do the apnea test. So when we can't do one of our tests, that means we go for a 4-vessel angiogram. So why do we do a 4-vessel angiogram? It's because we have 4 major arteries bringing the blood supply up into our brains. So one at a time in that CT angio, they're going to inject contrast dye. If there's circulation, we're going to see that contrast dye go up into the brain. If there's no circulation, it stops right at the nape of the neck, and we're not going to see anything to go in the brain. So when we can't do one of the other bedside tests, then we do this test, and that's to confirm brain death. Other types of deceased donation, we have donation after determination of circulatory death. So all that I explained before about all those tests we do for brainstem death, neurological death, suppose someone still had some reactions to one of those tests. So that means that they're not brain dead. They can still donate their organs, however, if we believe that if we give them comfort care, not euthanasia, it's very different. So it's just medication to make sure that they're not gasping for air and they're not in pain. And we extubate them in the operating room, and we believe that they'll die within that hour and a half. What we're really hoping for, though, is that they're going to die really quickly. Why? Because we have warm ischemia will happen to the organs. And warm ischemia is really bad for the organs because the organs will start dying because of the lack of oxygen. The faster we can get to the other part, which is cold ischemia, which is when after all the blood's been removed from the organs and they're flooded with the preservation fluid and cooled or put on those machines, the organs have slowed down enough that now the cells will stay stable and not die. So it's really, but in that OR though, because remember I mentioned before, I keep talking about people have to be dead. So how do we say someone is dead then? So when we wait for that time, when we have no breathing, and no, we don't see a cardiac rhythm on that monitor, then we start what we call a 5-minute no-touch period. And that 5-minute no-touch period is super important. There can't be any attempt of a breath, any kind of cardiac rhythm. And at the end of 5 minutes, it has to be a full 5 minutes. If there is a breath or a heartbeat, we start the 5 minutes all over again. At the end of that, those 2 physicians will be there to declare and to confirm death. What's really cool about this type of organ donation, when we're in the ICU for the neurological death, family members can be there the whole time and also through all the exam testing what we do for it to see what organs can be donated. And in this type of donation, we do all that workup before, and family members can actually be in the OR. So we've had some really cool music choices. I've heard of people playing music, AC/DC, kind of rock and roll music. There's been was a really cool French song that a family picked. It's Je suis bien à mon coton ouaté. That was a pretty funny music piece. But the person really liked that piece of music, and so we played that for them because they can still hear. And we want it to be comfortable for the person that's dying. And we also, for the family too, it's nice to have something that's there that reminds them of their loved one. So they can have a piece of music, they can bring down a picture, or anything else that they feel comfortable with. They can be with them. It can be with them and their family member at this end of life period. Other types of deceased donation, we also call, maybe on the news you've maybe heard of medical aid in dying. Well, medical aid in dying is for really sick people who've decided that, you know what, they've been suffering enough and they've had enough. And they just said, you know, life is not worth living anymore. And so they speak to their doctor about getting this medical aid in dying and just finishing their life. So this means that they've already said goodbye to their family members, or they're going to say goodbye. They tell their family members that they want to do this. And once approved by the doctor, if they're accepted, then they can also be evaluated for maybe organ donation. Now, not everybody can do organ donation, and 70% of people who ask for medical aid in dying, or what we call MAID, actually have cancer. So of course that means they won't be able to donate their organs, but the other 30% might be able to. So who would fall into this category? So we're talking about people who might have end-stage cardiac disease, or people with end-stage neurological diseases like Parkinson's, ALS, multiple sclerosis, MS. And so we asked them, would this be something they'd be interested in? And by the way, it's the same procedure for the other type of donation that I just explained before, the donation after determination of circulatory death, known to us as DCDD. It's the same 5-minute period. But in this case, when they go into the operating room, they know they're going to die for sure, because the medication is very, very different. The medication is there to cause death. So when the person is not breathing, the heart is stopped beating, that 5-minute period, no touch, starts all over again. The same 2 physicians are there to declare and confirm death, and after that, the transplant team can step in. And finally, we have tissue donation, which which is really cool, because organ donation, we can donate up to 7 to 8 organs and help people, because the liver could potentially be divided in 2, and same with the lungs. Tissue donation, one donor who can donate all types of tissues that were on that previous list can help up to 20 people. Pretty cool, eh? So who can donate tissues? So for tissue donation, there is an age limit. It's 85 years old. You can't have any history or current have any leukemia or lymphoma. You can't have any acute infections or systemic infections like HIV, hepatitis B or C, or a pneumonia that hasn't been able to be controlled by antibiotics. And you can't have any neurological diseases like MS, ALS, and dementia. So it's a lot more restrictive than organ. But surprisingly, you can still donate. One big exception with this, which you can't do with organ donation, is if you have a solid tumor cancer, so I'm talking about a breast cancer or a liver cancer, you can still donate your corneas. That's the only exception. So if you look at all the numbers for tissue donors, over 7,000 people in 2019 were able to be a tissue donor. Compared to, if you look back at the other slide for organ donation, it was 140 donors, 149, 150 donors, much smaller group, which means that almost 40, I think it's about 45 and 50% of people who die of just a regular, what I call a regular cardiac death, the type of death most people are familiar with, are eligible for tissue donation. So pretty cool, eh? So this is really important. And out of those 7,280 referrals, 962 people went on to be a tissue donor. And unlike organ, tissues can actually be stored. Cornea tissue, if you donate, it can be stored up to 14 days. Bones up to 5 years. So just for organ donation, we only remove the organs that can be used with the recipients. Tissue donation, it's the same thing. They'll only remove the tissues that they know that they need. So if their bone bank is low or their skin bank is low, they'll ask to remove those tissues. Corneas, because they can only be good for 14 days, they actually have an understanding with ophthalmology surgeons that they know exactly how many sets of corneas that they need every single month. So once they've reached that quota, they'll say to family members of eligible tissue donors, thank you, but no thank you, we're not going to take those particular tissues because we don't need them today. Donor families, they are the most important part of this whole thing. And it is really such a privilege to work with all of them because they agreed to meet with me, and they asked to meet with me at a very stressed moment in their lives. So it's really important for us that we do things that we make sure that they understand how special they are and how special their family member is. Because it's not just all about the organ donation, it's about saying goodbye and having memories too of their loved one. So we can have little stuffed animals that we can give to young children if they're available in the family, or sometimes when I have child donors, the little stuffed animal can actually be from the child to their sibling. We have coloring books, and we have paper and stuff that kids can color and draw pictures for their loved one. It can be a little story about them. I've had lots of grandchildren draw a picture of themselves and their grandparent, or maybe even draw a picture for their sibling. I had one family who the grandson decided he wanted to be sure that his grandmother was not alone. when she went into the afterworld and when she was buried. And so he asked everybody in the family to choose a color. They put the color on, and we made handprints. And we had all the handprints on one paper with the grandmother's handprint. And then that was put into the casket with her, so she'd never be alone. She'd always have her family with her. We also have memory boxes. You can see a bunch of the paint colors. Why so many paint colors? Because everybody likes different colors of paints. Everybody has a favorite color, and I want to make sure that everybody can choose their own favorite color. We also have a pen. I had a family that one time wanted to write messages of love and care on the person's legs. They weren't going to be a tissue donor, and they wanted to be sure the messages didn't get lost. Also, if you notice on the list there's a picture of a computer and a cell phone, and those are super important, especially these days. And a lot of our ICUs now are equipped with Wi-Fi. So this means that if your family overseas, or that we can use either an iPad or a tablet or a phone, and we can invite them into the room, and they can be part of everything, all the end-of-life care that's going on, and also be present too for all the discussions, and also when making a choice of whether organ and tissue donation will occur. We have 2 special books also for really young children. Our newest one is a little book that's in French right now that we hope to translate in the near future. And it's a book that's especially good for children from between the ages of 5 and 8. And it just explains organ and tissue donation really simply for them. The other book is meant for older children, say between 10 and 12, again explaining the process but with a little more detail. The most important thing of all is really to remember that each person, each family is unique, and that we really need to go at their rhythm. Remember that we treat each encounter as an honor and a privilege to be with them. And when we explain everything properly and people are given the time to take the decision, they're going to make the decision that best suits them and their loved one, and to honor what they wanted. And the result will be what best suits them. Thank you for your time and attention. Take care, everyone.